Welcome to BIADE's 2023 Educational Webinar Series sponsored by Highmark. I would like to thank each of you for joining the series, and I would like to ask for you to please put your name and location in the chat box, which is located in the top of your computer screen. Our guest speakers today will be happy to answer any questions that you may have, and please post them in the chat. Today, we will be talking about why emergency alerts and notifications are important during a time of crisis. And we have Robert Watts and Patricia Heineman, who will be our guest speakers. So before I introduce them, I do have a few housekeeping items. My name is Zawaya McElrath. I am the Executive Assistant for the Brain Injury Association of Delaware, and we are honored to have a special presentation today. I will be recording the series, and I will be posting the series I will be uploading the series to our website, Brain Injury Association of Delaware, as well as posting on our YouTube and Facebook page. And I'd like to introduce Robert Watts.
Thank you, Zawaya, and thank you, Pat, for inviting me. Like Zawaya said, my name is Robert Watts. I work for Kent County Department of Public Safety. Actually, let me start my PowerPoint here. Like I said, my name is Robert Watts. I'm the Operations Support Officer for Kent County, Delaware Public Safety. This is a picture of our building. At our department, we do have 3 divisions. We have our paramedics or EMS division, our emergency management, and then our 911 division, which is the division I work for. We dispatch for all fire, medical in Kent County, with the exception of Delaware Fire Department. We actually go well into parts of Newcastle County that are covered by Smyrna and Clayton Fire Companies, and parts of Sussex County that are covered by Milford Fire Company. Today, I'd like to talk about 3 technologies that are available to you free. They're not unique to Kent County. They're actually part of every Delaware 911 center in the state. They are Smart 911, Pulse Point, and the ability to text to 911. We'll start with Smart 911. Smart 911, why sign up for a safety profile? What are the benefits for Smart 911? When everyone had a landline phone, as you can see, we were able to get more information, such as your phone number, name, and address. Now, with about 90% of our 911 calls being from a mobile or cellular phone, the only information we get is a phone number and a rough estimate of your location. If you do set up a Smart 911 profile, you can see some of the many other benefits there in that 3rd column. I'll skip the videos for this presentation. If you go to smart911.com, you can watch a lot of different videos and cases, real life cases, scenarios from across the country where Smart 911 has assisted in saving lives. So what is Smart 911? Smart 911, you create a profile on a private, secure website where you make a safety profile with information that you will share with the 911 dispatchers. As I mentioned, the service is free for the end user. It's paid for by the state 911 board through your 911 tax. You can go to smart911.com, or you can go to your app store for Android or Apple and download their app. This is what the smartphone application looks like. You create your profile through there. If you do have the app, you can also get geo-based weather notifications and some additional information that is location aware. This is what the website looks like, smart911.com, very similar. Here you can see the breakdown of sharing the information. At the top, the people that are in your household, any addresses, phone numbers. If you do have more than one person in your household, you do create one safety profile for your entire family. So how does Smart 911 work? On the left there, you can see that's what the individual creates or family creates. There's smart911.com and the smartphone app. And then on the right is what it looks like for 911, how we can view your information. So Smart 911, it's triggered when you call 911, and it does pop up in front of the dispatcher sharing that information that you created in your profile. So things like in this scenario, unknown address or location, we could see what you put in your profile if there was a scenario where you didn't know your location. There's some success stories on their website with people out there that didn't think they'd ever be in a situation where they couldn't share the location, but being in an emergent situation, such as your house on fire, you can easily draw blanks and not remember some basic information you would think you would be able to remember. Also, Smart 911 can help in the case if you cannot communicate, whether it's a medical condition such as allergic reaction or heart attack or home invasion, other medical issues, allergies. You can share your medications in your Smart 911 profile. Also, things such as a missing child, if you want to share that information, we can have the access to your child's information, pictures, anything you want to share right in front of us so we can share with responders in the field. Security and privacy is a common question. So as I mentioned, you decide what to include. So you can provide as much or as little information as you would like in Smart 911. And we can only access the information when you call 911. So even myself as an administrator, I can't go look up someone's profile. Only you who create the profile can access it. And then when you call 911, we can access it. Smart 911 also does provide a more accurate location. When you call 911 without Smart 911, we're getting your approximate location from the cell phone carriers, which if you live in a rural area, we probably have a pretty good idea where you're at. But if you live in an area that's not as rural, or if it's like apartments, or if you're in a large building, then we might not have a good location of where you're at. Smart 911 does use a third-party service called Rapid SOS, where they combine additional technologies. So it's not just GPS, or using other technologies such as Bluetooth beacons or Wi-Fi access points to help narrow in your exact location. That is a high level of Smart 911, available, like I said, smart911.com or in the App Store. Some scenarios we've had in our county where it's helped out if someone has a medical problem where they have a hard time speaking. They can note that in their profile, so the dispatcher will see that. It will pop up, so they can get additional information. Also, where people couldn't stay on the phone, we could view their emergency contacts. We could reach out to their emergency contacts to get a more timely response. I should have asked this before. I'll go through the whole slideshow and then ask for questions specific.
I don't think we really discussed that. So Aya, what do you think? Should we take questions after each of our presentations?
It's actually up to you. If the participants have any questions, please feel free to answer any questions.
Okay, if there's any questions on Smart 911, please let me know.
Do we know how many, we can't go counties, so we'll go states, have Smart 911 now? Because doesn't this travel with you if you're like traveling from one state to another and they happen to have it? Then if you call from your cell phone, they get the information there also?
Yeah, that's a really good question, Dean. I should have included that. We can see the numbers on a countywide and statewide basis. I don't have that in front of me, but I can get that to you. We do look at that from time to time to see, it's actually broken down by zip code, so we can look at areas we might want to focus on if there's a low subscriber amount in a certain zip code. And another great point you mentioned is Smart 911 is available in the entire state of Delaware, and it's also available throughout the United States. Not every county or state might have it, but if you go to smart911.com, at the bottom of the website, there's an area where you can enter a zip code and see if that area is covered by Smart 911. But
that would be wonderful for emergency planning for when, our council is State Council for Persons with Disabilities. So when they're traveling, that would be wonderful for them to know in advance if they have it.
Yes, and Smart 911 is owned by Rave. which actually Rave has a state contract now for DENS that Pat will speak on. So there are some emergency management tools that you can pull from Smart 911 for your emergency planning.
Okay.
All right. Any questions for Smart 911?
I do have a question to piggyback on what Dee asked. And that is a very important point. If we knew how many states, actually did have the Smart 911 capability, especially for anyone traveling, because that would pull up, if you live in Delaware, but you travel to Ohio, that person gets a little more comfort knowing my profile's done. If I have an emergency, I know that the necessary information is in the database.
Yeah.
Is there a way that we could look into the Smart 911 system to find out those states?
Yes, anyone, like I said, could go to the website and type in a zip code. But if you're looking for a list from Smart 911, that's a good question. I wrote down here, and I will ask that. We do have a representative from Rave, the parent company, that oversees the state of Delaware. So I will send them an email and get you an answer on that.
That'd be great. Thank you.
You're welcome. All right, if there's no more questions on Smart 911, I'll move on to another technology that we offer called Pulse Point. Pulse Point is an available smartphone application for Google and Apple. We consider, or we use, we say Pulse Point Respond is kind of like an Amber Alert for a sudden cardiac arrest victim. What Pulse Point does is it automatically from our CAD system sends out an alert to a smartphone user who has this app on their phone. If there's a sudden cardiac arrest in a public location, that user is within a half mile from that incident. Another part of this is called Pulse Point AED. This allows us to crowdsource AEDs throughout the state. As imagined, it's a near impossible feat to track all the AEDs in any location, including in our state. So this is a separate app also available through your app store that allows you to capture, you can see where AEDs are in public locations. And if you notice one's not in there, you can get some basic information off your phone and add it to our registry. And then our administrators will get a notification. They make sure the information is all there. If not, they can reach out to the person that submitted it, and then it gets added to our AED registry. If a user is alerted in the Pulse Point application and there's an AED nearby, it will let that user know. Also, the software that we use in the 911 center, if there's an AED nearby, our call taking software cross-references that same database so we can let the caller know, even if they don't have this application. I have two short videos on Pulse Point. The first one is on the Pulse Point Respond application, and then the second one will be on Pulse Point AED.
This is Joel. He just suffered a sudden cardiac arrest. He isn't the only one. Today, 1,000 people in the United States will have the same experience. Time is now critical. As a call is placed to emergency dispatch, the clock continues to tick. Emergency responders are several minutes away. Unfortunately, several minutes can be too long. For every minute Joel goes unaided, his chance of survival decreases by 10%. Fortunately, Joel lives in a Pulse Point connected community. Pulse Point is integrated with his community's emergency dispatch. The moment Joel's emergency call came in, a Pulse Point alert went out, connecting nearby CPR-trained volunteers and AEDs to his location. Meet Scott, an off-duty firefighter out running errands, and Donna, a financial planner working next door. Because they were nearby and quickly alerted, they're now able to provide life-saving care until emergency responders arrive. That initial care made all the difference. This is Joel. He's a sudden cardiac arrest survivor. Armed with Pulse Point, any volunteer can help save a life. Become a life-saving volunteer and download Pulse Point today.
And here's the second part of that, the AED registry app.
AEDs. You may pass by one every day and not even notice, but these little guys save lives. The problem is, when you need one, you don't know where to find one. What if we could arrange a meet and greet with our AEDs, allowing our community to get to know where they hang out and what they look like? Introducing PulsePoint AED, the app that asks you and everyone around you to report and update AED locations. It's simple. When you find one, enter a description and snap a photo. That's it. The information is vetted and centrally available so that nearby citizens and emergency dispatchers can locate one when a cardiac emergency occurs. With AED locations mapped and the PulsePoint Respond app in hand, Donna is alerted. Using the map, description, and a contextual photo, she finds her trusty assistant. Within moments, she's at the victim's side, ready to provide essential early care until help arrives. Using an AED can save a life, but that takes knowing where AEDs are located. Help build the most comprehensive registry of AEDs for use during emergencies and help save lives. Download the PulsePoint AED app and the companion PulsePoint Respond app today.
All right, so hopefully those two videos helped give an overview of what PulsePoint and PulsePoint AED is used for. These are screenshots I took of the actual apps. The red app on the left is the PulsePoint Respond app. It also connects to our CAD system. In order to keep users engaged, you can get some basic information for medical calls, obviously with privacy, HIPAA reasons. We don't give exact addresses, but we do give some basic information of medical emergencies and fire emergencies throughout the county. I like to think of it like a high-tech scanner instead of an old scanner where you can listen to the fire department. You can view some calls on this application. Obviously, we do block some things out, even for the cardiac arrest. In public locations, we don't send out things such as overdoses or assaults. You won't see them in the app, or they won't go out in the app. On the right there is the PulsePoint AED. What that application looks like. I was doing a presentation at our county building, so I zoomed in on that area, and it shows the 4 AEDs they have in that building, and you get descriptions of where they are. We even asked the users to take a picture from about 6 to 10 feet away in case somebody was walking into that room quickly looking for an AED, they can kind of see where they should be looking at. Whenever there is a PulsePoint notification, our administrators, we do get an email notification. It looks similar to this. Just shows where it was and how many people got notified. We also get a map. So this is just showing the cardiac arrest incident in the middle of this red heart here. And then this red area, the circle, is the half-mile radius that we were looking for users. And you see the yellow persons here. These are users that got notified. You can also see available AEDs there. So when someone does get notified, it is anonymous. Other than knowing how many people got notified, we don't know who got notified. If you do get notified at the end, you get an optional survey. If you do complete that survey, then we do get that information. Otherwise, we don't get any information. Unlike Smart 911, where I did not get the stats, I did get the stats for PulsePoint, and we have about 11,500 followers following Kent County. And we can't see personal information, but we can see approximate locations for people that are following us in the app. And this is just kind of a little overview I did of the whole world, and then zooming in, to the US, then even our regional area.
That's amazing.
The city of Dover. The red person icons, whatever the proper name is, those are verified responders, which I will get to next. Like I said, we did have 11,500 followers with about 6,500 of those followers getting active CPR alerts on their phones. I'm sorry, Dee, I just noticed you had your hand up, or was that from earlier?
Yeah, but that's okay. At first, I wanted to say I love the Pulse Point app. I have it on my phone. It is phenomenal. Second, I'm trying to remember what the question was for second. Oh, have you done a presentation with the state of Delaware leadership because I know personally, like there's an AED in the public safety building and there's one in the DelDOT admin building, but a lot of the state agencies have them. And if they could take the picture and post it, they're public buildings anyway, and that would help.
Yeah, so when we set this up, we try to send our dispatchers and our staff around to different agencies, schools, state buildings to gather these. But as you can see, I'm sure there's quite a few missing. So if you do have contacts for any of those, I'd love to know about it and I can reach out to them.
Okay, not a problem.
So that leads into what we showed on that last slide with the red icons. Those are a verified responder. So the public can download and view Pulse Point, but verified responders, if you're an off-duty firefighter, paramedic, police officer, nurse, things like that, you can register to become a verified responder. It's where we have to verify the actual person in the system, and then on their device, their single device, they become a verified responder. The difference is verified responders, we show all calls, not just the cardiac arrest in the public areas, but also any cardiac arrest, even at a private location. So the thought is if a firefighter, paramedic, police officer, if they're at home and their neighbor goes into cardiac arrest, they can assist for scenarios like that. Sorry about that. This is blocking my notes here. And last time I looked a few weeks ago, we had just under 300 verified responders in the system. So just over 11,000 total and about 300 verified responders. That program is fairly new. We rolled that out last year, so we are still advertising that to responders. This is another example. There's a cardiac arrest in this mobile home park. And we did get notification there's a verified responder there. I got notified for that cardiac arrest at a private location. Any other questions on Pulse Point?
Yes, is there a link that we can get to share on our websites?
Yep.
Not just for Pulse Point, also for the earlier too.
I think, and you mentioned when you work for Homeland Security,
Yeah.
the E911 board, they do have a website. I'm not sure if all the links are on there, but I will
I'll
get you the-
double check on that, but they wouldn't have the one for Pulse Point, would they?
No, yeah, you're right. Smart 911 and Text 911, which we're about to talk to, are fully funded by the state 911 board, but Pulse Point is paid for by the county. So you're likely right on that.
Okay, yeah, I'd just like to share it on our websites and social media to help get the word out more.
Okay. I'll send those to Pat so she can share
Thank you.
your information. Where's Ohio? All right, then the final technology I wanted to speak to this afternoon was the ability to text to 911. Their slogan was, when they rolled this out, they rolled it out almost 5 years ago. It was March. Right there, March of 2018. They were saying in Delaware, call 911 if you can, text 911 if you can't. So we still do prefer a phone call because we get a lot more information. But if you can't call, you do have the ability to text anywhere in the state. And actually, that is not this is not nationwide, which may be hard to believe, but in all of Delaware, we've had this for the last 5 years. So this is a picture of Governor Carney. He sent the first text to 911 out up in Newcastle County. Here's a screenshot of a test I did here in Kent County. So this is what it looks like. If you send a text, you will get an automated text back with the 911 center that you reach. So in this case, Kent County 911. And then the first thing we do text back is, are you able to call 911? Like I said, we do get a lot more information, better information quickly if we can speak to someone. But if you can't speak, then we will go ahead and have the conversation through text message. It's just like any other text message you sent, you just simply, the recipient will be 911, and then you just send your normal message. It has to be text only. We don't have the ability to do pictures or video yet. However, that will be coming in the future with next generation 911. Any questions on text to 911?
I just had kind of a comment about it. When I present, if I've been in a couple of community events where I had a handout from Joe Thomas down in Sussex County, the emergency manager there, about text to 911, it's very well received. A lot of people have not heard about it, and they like having that as an option. But as I'm pretty sure you did just say, Rob, that the preference is that we call 911 if at all possible. But since like Smart 911 is a communication tool in itself that enhances the 911 response. What if someone decides to text for whatever reason, and they didn't hear a response back from the dispatcher? What would be your recommendation? They try again, or they get someone to call for them if they're able to?
Yes, if you did not get a response, our system works the same if it's a text or a phone call. There is notifications that we get, just like a 911 disconnect would be similar for a text message that we're not responding to. But yes, I would try again, and if not, then call 911 or have a friend call.
Okay, thank you.
We do have the ability, text 911, just like a voice call, we can transfer to other 911 centers throughout the state and neighboring, in our case, Maryland counties for King County, Delaware. And if the operator does disconnect, you do get that at the bottom right there, that it was ended. And if you have to restart a whole new conversation via text or voice, if you have more information.
Okay, now I know it's not nationwide, it is Delaware wide, but if you're using a cell phone to text 911 and that cell phone is registered with Smart 911, am I understanding correctly? It doesn't have the capability to still bring up the information for the 911 operator?
You are correct. That's a great point. That's why we always recommend calling, because we do lose some technologies, including Smart 911 if you text. Smart 911 is triggered off a phone call to 911. They are working on that, and Joe Thomas had that, where he was working with Smart 911 on that.
Yeah, that's very much needed for our deaf and hard of hearing community, because
Yes.
of course it might be difficult for them to call and get the relay operator and then go through all that. But if they can text direct, response could be faster.
Yep, exactly.
Good point. This is going back to the AEDs. Is there any national standard that organizations have, and are they required to have an AED in a building of a capacity of X number of employees, or is it strictly volunteer who decides to incorporate that?
That's a good question, Pat. I can ask our EMS division if they have any information on that. There's nothing that I know of on a national level. On a state level, I don't even know if there's.
Yeah, I don't think there's anything on the state level either, because otherwise then I know a lot more agencies would have them. Plus, when you get them, then you have to have somebody that's certified come train people in your building on how to use them, even though it does talk you right through it and has little pictures and everything. And most people of average intelligence should be able to figure it out themselves, but they do require you to have the training on it.
Thank you.
All right, and finally, I just throw in towards the end of my presentation that answer all the dispatchers' questions and realize that you're not speaking to the only person in the 911 center. So while the call taker is is processing your call, there is a dispatcher in the background that's sending help in real time. The answer to those questions do dictate the response. We make sure we send the correct response level, whether it be police, fire, or medical. And no one plans to call 911, but now you can help plan ahead, provide police, fire, and EMS information you need to help you in an emergency. And I try to go fast, but looks like I did run over. If you or anyone are interested in having me speak virtually or in person for any group, organization, your workplace that you're part of, I'd be happy to come out. Normally I do about a 45-minute speech on some of these, dive in a little bit deeper than we did today. There is my contact information on the screen. I did write down the questions. I'll get them back to Zawaya and Pat since I have their email information, and they can email it out to those who have the questions.
Thank you very much. This was very interesting.
Thank you.
That was great, Rob.
Thank you so much, Rob. That was really informative. A lot of good information. I don't live in Delaware, but I want to move to Delaware now because it's smart now. We're going to actually go over to Patricia Heineman right now, and she is going to talk about readiness, resiliency, and planning, correct?
Well, I'm basically focused on DENS, the Delaware Emergency Notification System. Yes. Thank you, Zawaya. Were you? I'm not sure. There we go. Thank you for pulling that up. As part of the year-long webinar series with BIADE, Readiness and Resilience Planning, I was asked to participate today in the Delaware Emergency Notification System information called DENS. And so the purpose today, if you would like to go ahead and advance, we were having a little glitch with my laptop today. Thank you. The purpose really is pretty simple. You already heard Rob describe the importance of signing up for Smart 911 and some other aspects related to Smart 911, pulse point and the other points he mentioned. But the other aspect of us getting accurate information during an emergency, before the emergency and after, is that we all have an excellent resource here in the state called DENS, the Delaware Emergency Notification System. And that's set up through the DEMA website, the Delaware Emergency Management Agency. So that link is pretty important. If you're able to write it down, dema.delaware.gov. When you click on that and you pull down the toolbar, you will see that you can just access the emergency notification system. Next slide, please. And we're going to show you a quick video towards the end. I have to emphasize, as I did in January, that the big umbrella of discussion around the series on readiness and planning for emergencies really is also focusing on each of us taking some responsibility in preparing. We do rely on first responders during crises, during medical events, during disasters, weather-related events, all the risks that we certainly are aware of throughout our state, but it really has to begin with each one of us doing our part. Next slide, please. So today's part really is about communication. Communication and getting accurate information. Those two elements are key in disaster preparedness. And so the question I'd like you to be thinking about in the next 10 or 15 minutes, how would you get information and warnings that you can trust and that are reliable? And in our state, we've got the beauty of DENS to answer that question. Next slide, please. I mentioned risks, and just to make sure, I don't know how thorough residents are when they think about their perceived risks where they live. And it's different for each one of us. Certainly, if you're more coastal, you've got a different component of risk. But when we talk about weather-related events, certainly depending on where the event hits in the state, we're all going to be impacted by something, and maybe you already have been, depending on your location. Power outages with heavy rains, any potential fire, we obviously saw the impact of pandemic and how that helped all of us understand very quickly the importance of a shelter-in-place kit or a family emergency kit. But road closures due to an event that's only temporary can totally impact your driving status for that hour or the next 4 or 5 hours, and school events. So it's important for all of us to somehow be able to make sure we're getting information that helps us to respond accordingly to that event, no matter where you live. And DENS, again, is that solution, or one of the best solutions here in the state. Next slide, please. Why is it helpful? Well, DENS really is the primary public warning system here in the state. State agencies, counties, municipalities, they all utilize DENS to inform and warn the public about adverse possible reactions to an event, whether it's health-related, safety, or our overall welfare. But the system does allow local 911 centers or emergency managers, such as Rob and his colleagues, that can send out messages about a specific event around their location, their neighborhood, their street. And the DENS system will, if you have a landline, your address and your landline number is already in the system. So I will say that point again. If you have a landline and that address for that landline and that number is in the system. But I want to emphasize that those people like myself who rely on cell phones, mostly all of us, if that's not registered, if that number is not registered in the DENS system, then that message is not coming to your cell phone, which if you're away from home, that's an important point. In the event of the line being busy, the DENS system will retry 2 additional times to deliver a message. It also will leave a message on a voicemail system or an answer machine. Next slide, please. And Rob, since you also work with DENS, please correct me or interject at any point in time. This is what I've already said, because I think it's one of the most important takeaways. First is do it. Sign up, please. But secondly, if you have a landline, and I did double check with DEMA, because about a year ago, I was under the impression that maybe that was being looked at a little bit more. But as of today, landlines that you have are in the system with the address associated to it. So we're going to show you, next slide, please. Cell phones must be registered. It enables DENS to actually make sure that your home or work address is aligned with your cell phone and the message is delivered to the cell phone. If you have a voice over internet protocol system, or you have a business, for example, when you go with a bigger system to be able to make calls anywhere that you need to be, whether it's in a building or receive messages if you're not at your desk, messages also are sent to that number. And that number you may want to interject on this one, Rob, that VoIP number kind of is like, it looks like it's a series of digits, but that you put that number into a pad that you're given once you register for the system. Is that correct?
Yes, it's just important to note if you do move, sometimes depending on your provider, you might have to update that manually yourself.
Okay, that's a good point. So also going back to your own cell phone, take a look at who's in your home and the number of cell phones that you have in that home. Every cell phone should be entered into DENS. Next slide, please. So when you go into DEMA.delaware.gov and you pull down on the top bar, and we're going to show you that on the video in just a minute, the emergency notifications, you're going to see this page. And you can see right here, sign up now. When you click on it, it literally takes minutes to basically add your name, your address, and your number. We're not looking for all the information that Smart 911 was looking for. And then you should be starting to get relevant notifications about impending disasters, impending weather-related events around your location that may impact decisions you may have to make around travel or any of the, any evacuation, if that were mandated in the state, your alerts and notifications come through either phone call, text messages, email, and also social media. Next slide, please. And I've already mentioned this too. I kind of took the thunder out of some of the slides, but I want you to leave today knowing that DENS is a trusted source for information before impending hurricanes, for example, during the event, and following unexpected events. We can rely on a trusted partner sending out those messages to us. Next slide, please. There's a short video that will kind of quickly, in like 3 or 4 minutes, go through what it would be that you see when you go to sign up your cell phone number. See. Is it just me? I'm not hearing anything.
Yeah, I can't either.
I'm not hearing anything.
No, I'm not hearing anything for some reason.
Signing up for
Can you not hear?
Yeah, I
No.
think now try it again, because I just thought I just heard some.
even seconds can mean a matter of life or death.
Yeah, we're good.
Emergency Notification System, or DENS, provides public warning and emergency protective action guidance when emergency situations occur that could affect the health, safety, and welfare of Delaware residents. When an emergency arises, DENS allows local emergency managers to send messages directly to residents, targeting the specific street, neighborhood, or area affected. Signing up for DENS is easy. Simply visit dema.delaware.gov. Select the information dropdown. Click on Emergency Alert Services, then click on DENS. Register right through the website. Complete the form with your name, email, and phone number. Then click to submit. Remember, this should be the phone you primarily use, which may mean your cell phone in addition to or in lieu of a traditional landline. As landline phones decrease in use, it is important to register as many phone lines as possible, including your cell phone. Once registered, the DENS system will issue notifications for natural disasters, floods, hurricanes, tornadoes, as well as emergency situations, if affected in your area. These notifications have proven to save lives. All it takes is a minute to register, and minutes can be the difference between life and death. Sign up now at dema.delaware.gov to help prevent a disaster from happening to you or your loved ones.
Thank you. Thank you, Zoya. Do we have just a couple more slides, I thought, but perhaps not. And if we go to the next slide, please. One additional point on DENS, that you cannot add a post office box, PO box number. They don't have, that doesn't indicate a physical location that would be affiliated with your cell phone number, obviously, or your home number. Next slide, please. Also, notifications in Delaware that you may likely receive if there's a school closing or delay or early dismissal. I think you can read the list. I'll just go over it briefly. Statewide school-related announcements. Sometimes, daily an e-message or an email that would suggest this day in Delaware, if it's public information that we may want to know about, any sex offender status change, and cybersecurity updates from the Department of Technology and Information, regulatory and legislative actions, vendor notification, Delaware code notifications. I think some of that is limited. I'm thinking and I see that, I don't know if Rob is still there. I'm not so sure that some of that information all of us would need to have. What you want to hone into, I think most of us would rely on weather-related events, closures, incidences that affect any part of your safety and well-being as well as health. Those are the notifications I think that are mostly put out. Next slide, please. So I wanted to just emphasize, please, before the end of the week, if possible, sign up for DENS. It takes only minutes, and share that information with some of your colleagues, people that you work with, your neighbors, your family members that are in the state of Delaware, because that would be a dream come true that we have. After today's presentation, we have a lot of things happening with Smart 911, with numbers, people signing up, as well as DENS registry up in numbers. Next slide, please, and that's closing. If anyone has any questions, I'd like to thank you, though, for your time today and being interested in not only communication, but information sharing around disasters and preparedness. Oh, there you are, Rob.
Thank you, Pat. Yes, I was wondering about, I'm glad you said something about, how much you would get of the legislative updates or the cybersecurity updates. Because of course, as a state employee, you're aware we get them the first of the month every month.
Yeah. Well, it's a good question, Rob. You might want to take that. As far as cybersecurity information, I would say there's a bit of selectivity in terms of what goes out through DENS. Am I wrong?
Yeah, I've actually never heard of those other categories that you mentioned there, Pat. For our purpose, it's only going to be emergency only, an active emergency or preparing. Like I mentioned on our call last week, we use it sometimes, like for our coastal communities in Kent County, Delaware. If we know there's a nor'easter or a potential for flooding, more flooding than normal for some of those coastal communities, we'll send out information like that, or Amber Alerts, real time. There's a hazmat incident, people need to evacuate. Those are our uses. So I've never seen the other side if the state or someone else is using it.
Yeah, I didn't. I wasn't aware of those. That's why I was surprised when it showed those, because I was like, okay, how would they know what legislative issues you're interested in?
Well, it's funny you bring that up, because I ran it by DEMA last week with my presentation, obviously, and I just want to make sure it's accurate. If there were any updates, any new kinds of things going on. No, she said it was very thorough and accurate. So I didn't double down and just say, tell me more examples about those last 3 items. I didn't, because my thinking has always really, I've kind of focused what we focus on in preparedness, weather-related events,
Right.
incidents around
And that
safety
makes
and
sense.
health and welfare. But I think it's worth me going back and just just out of curiosity, and share it with you again through BIADE. What is the response that I got, or what additional information or resources could be shared with me that I could share with you around that topic. It seems that I would think in this day and age, although that was current, it still would be a little bit of a pause before what might go out and what maybe could be critiqued and weighed before and measured before it's really sent out there.
Okay.
I'll get back to you,
that's-
Luaya.
Thank you. I appreciate that. And then the other thing was, okay, most of the state buildings have a PBX system. So we've always had trouble when we call out. Nobody knows where you're calling from because it gives you one of 4 numbers. It's not the number to your office. If somebody calls it back, they're going to get some random person, not who called them. And that causes a problem. So that would be a good push for you to take to the cabinet secretaries to bring up and share that buildings with PBX numbers should register their work number for the person in DENS.
Good point on that. I mean, has that been a challenge that you know of, Rob?
Oh, we had to change ours. Well, okay, over at OSAC, it's a PBX system. So the number that shows when somebody calls you is not their extension number or their direct line. Here at the O'Neill building, we had to have it changed because we used to have to dial 9 to get out. Well, then when people were trying to reach 911, you were dialing 9911 and it was causing issues. So now they changed it so that we hit a star, the asterisk, to get out and then dial whatever number we need. Of course, that was before they added the lovely have to dial 302 for everything now in Delaware. But yeah, there are a lot of state buildings that only have a PBX system. So that's really something they should bring up and spread throughout the state agencies.
I will get back to Krista Hansen at DEMA on that and see if that was something that's been in the works for change, because as of last year, Paige Fitzgerald, the assistant director of DEMA, we had a conversation around a couple of other things around DENS that may have been one of the points that she didn't disclose, but is being worked on, because, you know, bigger projects I'm certainly not going to be privy to, but I will get back to you on that too. I got my homework, Dee.
See, we ask good questions.
Well, we don't know anything unless we ask questions. I love questions. So I think questions move us to the next level of preparedness around
And
the
I'll
clock.
definitely share both y'all's information on our website when we get done here so that we can get the word out and maybe get you some calls.
There we go. That's terrific. Thank you.
Are there any other questions for Rob and Patricia?
See, you did such a good job of presenting. No questions.
Well,
Okay, well, I want to thank everyone for joining. I want to thank our presenters, Robert Watts and Patricia Heineman. As I said, I will be uploading the webinar series on our website as well as on Facebook and YouTube. And I want to thank you all for joining, and please spread the word and please share it with everyone. This is important information to, you know, the Delaware notification emergency system. It's very important information. Smart 911, the pulse information was great. So just thank you so much. And that concludes our webinar for today.
thank you so much.
Thank you.
Thank you. Bye.